Gluten allergy is a misleading term commonly confused with wheat allergy, or sometimes celiac disease. There is no such thing as a gluten allergy, but there is intolerance of gluten. A food allergy occurs when the immune system reacts to a harmless food. Food intolerance occurs when the body has a chemical reaction to eating a particular food or drink. An allergy is an immune system response, while isolated digestive issues usually point to a food intolerance. Gluten intolerance. Gluten is a protein found in many foods, especially wheat, barley and rye. It's in a lot of common foods and drinks, including pasta, cereal and beer. Gluten can also be in things like vitamins, cosmetics and even certain medications. There are several potential causes of gluten intolerance, including celiac disease, non-celiac gluten sensitivity, and wheat allergy. Celiac disease is an autoimmune disorder associated with a long list of symptoms, including diarrhea, constipation, fatigue, chronic pain, depression, anxiety, unintentional weight loss, and more. Non-celiac gluten sensitivity is a form of gluten intolerance that can cause headaches, depression, anxiety, brain fog, fatigue, pain, and digestive problems. Wheat allergy is a type of food allergy that may cause skin rashes, digestive issues, nasal congestion, and anaphylaxis. Gluten intolerance can have numerous symptoms. If you regularly experience some of them without an apparent cause, then you may be reacting to the gluten. When you have celiac disease or a sensitivity to gluten, following a gluten-free diet can be challenging. Following symptoms for several hours or days after they consume gluten: abdominal pain, anemia, anxiety, bloating or gas, brain fog, or trouble concentrating, depression, diarrhea or constipation, fatigue, headache, joint pain, nausea and vomiting. How is gluten intolerance diagnosed? Your healthcare provider carefully reviews your symptoms and medical history. If they suspect you have a gluten intolerance, these are the next steps to confirm the diagnosis. Step 1. You eat a diet containing gluten for about 6 weeks. During this time, your healthcare provider performs blood tests and skin tests to rule out a wheat allergy or celiac disease. There isn't a gluten intolerance test. Step 2. If you don't have a wheat allergy or celiac disease, your healthcare provider will ask you to exclude gluten from your diet for at least 6 weeks. Keep a thorough record of your symptoms during this time, noting which, if any, symptoms improve. Step 3. If your symptoms do improve while you're on a gluten-free diet, you gradually reintroduce gluten back into your diet. If symptoms return, you likely have a gluten intolerance. The primary treatment for gluten sensitivity from any cause is a change in diet. However, there are plenty of gluten-free options available to replace wheat. From providing antioxidants to reducing your risk of disease, these nutritious gluten-free grains can significantly benefit your health.